Welcome, and thank you for joining us for this educational overview about lifestyle improvement with hormone balance for men and women. We'll show you how this popular therapy is helping patients and how it can dramatically reduce unwanted symptoms associated with aging. Bioidentical hormone replacement therapy has grown dramatically in popularity over many years, thanks to patient success of inserting tiny pellets just under the skin for dynamic hormone delivery to the body as needed. What exactly are hormones and why are they important? Hormones are very important chemical messengers secreted from the endocrine glands, directly into the blood, and transported to organs and tissues of the body, where they attach to receptors. These messengers work in a lock and key fashion to exert their functions such as feelings of well-being, mental activities, sleep quality, weight management, energy levels, and even libido. As we age, hormones naturally decline, resulting in unwanted symptoms. If you've experienced symptoms of decreased hormones, you are far from alone, and it's not your fault. Studies have shown that by the age of 40, women can have lost 50% of their testosterone production, and 40% in men.
I have been struggling with premenopause and menopause. I tried the natural way, tried all the natural ways for over a year. I worked with my gynecologist on different estrogels. Nothing was working. I couldn't sleep, couldn't focus. I'm in an industry where I need to be attentive all the time, fast moving, have high energy. So being in that industry, working around a lot of men and having hot flashes is not fun. So struggling with night sweats and hot flashes was probably the biggest part for me. And hot flashes happen from the toes all the way up. And you know it's coming and you're just trying to be really nice and be normal. And meanwhile, a little trickle of sweat's going down your face. My whole body got red where people are leaning over, "Are you okay?" And I'm like, "Yeah, I'm fine. Give me a minute. I'm over 40. When you have that kind of hot flash going through you, there's no way you can think normally when you wake up in the morning. There's no way that anything is normal. And I was moody. You're tired, and I'm not a tired person. Well, I'm here to say, I feel beyond great. Between being able to sleep at night, no night sweats, no day hot flashes, my sex life, amazing. Just being able to focus, getting your energy levels back. I literally, as soon as I started it, within 3 days, had no hot flashes. My body temperature was beyond normal. I have 2 kids that are in their 30s, and they are all like, "Mom, what's going on?" Because my energy level's back up, I'm organizing things, I'm going places, I'm multitasking without freaking out when I forget something. There's no way I could have said thank you enough for me getting my life back. And that's exactly what it did for me.
The first thing you need to ask yourself is, how do you feel? Are you experiencing mood swings, tension, or anxiety? Or do you feel like this? A healthy sense of well-being, high energy levels, sleeping well, and feeling like it's not impossible to lose that extra body weight. Here are some common female and male symptoms that are associated with decreased hormone levels. Low energy, night sweats or hot flashes, poor sleep, vaginal dryness in women, low libido, fatigue, poor mood or depression, low concentration, or brain fog. No motivation, stubborn weight gain regardless of diet and exercise, decreased sexual performance. Do some of these apply to you? Most of the low hormone symptoms are traditionally addressed in 2 ways. We either attempt to relieve the symptoms ourselves and grab the B12, energy drinks, and other uppers, weight loss medicine, and the list goes on. Or we visit a doctor, which too often turns into prescriptions as band-aids for broken arms, and then more prescriptions to counter the previous ones, all while avoiding the root cause of the issue. If a doctor is not a trained hormone specialist, they may prescribe pain medications for fibromyalgia, which can lead to addiction and drowsiness, or prescribe antidepressants for depression, which can cause sexual dysfunction and other negative side effects. Sleeping pills for patients experiencing insomnia that can result in worsening sleep apnea or daytime drowsiness. Men experiencing erectile dysfunction are given a pill, and the list goes on. Let's start with women. These symptoms are usually attributed to menopause. Statistics show that 6,000 women enter menopause every day. and some experiencing symptoms up to 15 years prior to even entering menopause. Many women are surprised to learn they produce testosterone as well as men. Due to the gradual onset nature of menopause, most women don't realize how many ways they've been affected over time, and many never get over or get through the unwanted symptoms of menopause. In men, we attribute these symptoms to andropause, and sometimes called manopause. 20% of men over the age of 50 have low testosterone levels. Low testosterone is also commonly associated with high blood pressure, diabetes, sleep apnea, and other chronic diseases. In men, early heart disease has also been linked to low testosterone. Let's take a closer look at estrogen. Both men and women produce estrogen, with large amounts in women and smaller amounts in men. Estrogen has over 400 functions in the human body, including, for women, controlling hot flashes, helping maintain bone density and memory, colon cancer protection, maintaining moisture and elasticity in our skin. Also connected is the feel-good receptors of serotonin and dopamine delivery to the brain. Many internal and external influences can decrease estrogen levels in the body. Now let's talk testosterone, present in men and women with larger amounts in men and smaller amounts in women. Testosterone has over 3,000 functions in the body and is one of the most active hormones in women. Men from the age of 30 to 70 years old will lose 1 to 3% testosterone production each year. Women ages 20 to 40 can lose up to 50% of their testosterone production. Aside from the symptomatic relief experienced with hormone balance therapy, testosterone may also provide protection from diseases such as osteoporosis, Alzheimer's disease, cancers, heart disease, and arthritis. A common misconception is that only men need testosterone, but the truth is, women also need testosterone. Even though women make far less of this hormone, a small deficiency can cause large, unwanted symptoms. As you can see from the leading causes of death in the US, many of these are associated with low testosterone levels. Now, let's quickly discuss common hormone replacement options and why this practice prefers the HTCA method of pellet therapy. The type of hormone treatment you choose is critical to the therapy's success. HTCA uses tiny bioidentical hormone pellets versus synthetic hormones for many reasons. Bioidentical hormones are the exact same chemical structure that we were all born with, while synthetic hormones are not. While synthetics can have similar analogs when compared to bioidentical, they are ultimately not the exact same as what's present in the body. Depending on how the hormones are delivered to the body, bioidentical hormones have the exact same molecular structure to the ones already circulating throughout your bloodstream. This is not true when it comes to synthetic hormones and can cause life-threatening side effects due to the interference or blocking of the proper hormones to the hormone receptors. Progesterone is a great example of bioidentical versus synthetic hormones. There is a difference in the chemical structure of bioidentical or natural progesterone and synthetic progestins. Now let's take a quick look at the different types of hormone replacement therapy, as well as the delivery systems. Pills can be a choice for hormone replacement therapy. Some of the downsides are the peaks and valleys of the hormone levels experienced, and that pills must first pass through the liver, which changes the chemistry. Pills are also required to be taken every day. There are also a number of potential and unnecessary effects of oral estrogen therapy, including breast tenderness, increased risk of endometrial and breast cancer, vaginal bleeding, headaches, nausea and vomiting, fluid retention, blood clots, leg cramps, and gallstones. Patches are another option of hormone delivery. While patients often experience higher levels of estradiol with patches compared to pills, they are still lower than that of pellets. Common issues with patches is irritation from adhesive, as well as inferior absorption, with research showing that 45 to 60% of women do not uniformly absorb estrogen through the skin. Patches also need to be changed throughout the week and can result in weight gain. Another delivery system is using creams or gels. Similar to patches, creams and gels are often associated with absorption issues. Creams and gels require the patient to determine the daily dosage with how much they apply to their skin, leaving patients wondering if they applied too little or too much. And with a short half-life, it is often required to be used twice daily. Another major concern with creams and gels is that they can be transferred to children or pets, which can be harmful. Injectables or shots are sometimes used when administering testosterone, especially in men. Injectable testosterone often results in uneven absorption of the hormones and a significant roller coaster effect of the hormone levels with high peaks and low valleys during usage. Most injectable testosterones on the market are using synthetic hormones. There are many significant adverse side effects of injectable testosterone: liver toxicity, heart disease, elevated LDL, VDL, elevated bad cholesterol, and decreased good cholesterol. Our choice for hormone replacement are pellets just placed under the skin, usually in the fatty-most part of the hip. HTCA providers are trained to offer patients these tiny pellets comprised of natural hormones, identical to the body, and are made from yams or soy. Unlike other delivery systems, pellets dynamically release hormones to the body, as needed, depending on daily activity levels. Also, pellets avoid the first pass through the liver, as capillaries form around the pellet for efficient delivery to the body. Pellets are individually dosed, depending on many patient health factors to get the exact hormone levels that each patient needs. Pellets also provide the longest-lasting therapy, with women getting the pellets every 3 to 4 months and men every 5 to 6 months, based on their cardiac output, offering a set-it-and-leave-it therapy. Pellets have been around for quite some time. They were developed in the early 1900s for women with radical hysterectomies and have been widely used in Europe and Australia over many years and refined over time for optimal hormone delivery. Let's take a look at the yearly treatment comparison between the other methods of hormone delivery and HTCA pellet therapy. Depending on your physician's suggestion, shots are required anywhere from 26 to 156 times per year. Creams and gels can be anywhere from 365 to 730 or more times a year. HTCA pellet therapy only requires treatment 2 to 4 times per year. The number one reason we suggest pellet therapy: pellets deliver a steady flow of hormones to the body, eliminating the roller coaster effect of a patient's rising and falling hormone levels throughout the day. Not only does pellet therapy require the fewest amount of treatments per year, but offers the most consistent pharmacological level of hormones in the body. You can see from this graph the peaks and valleys of the other hormone replacement therapies, while HTCA pellet therapy provides a consistent, steady state of hormones delivered to the body over the course of the treatment. Let's take a closer look at the other benefits of pellet therapy. There have been hundreds of tests and studies over 75 years with a long-term, worldwide safety record. Clinically effective means that pellets most closely mimic hormone release, reducing the roller coaster effect that other therapies are associated with. Protection and prevention are common benefits that patients and doctors appreciate, as studies have shown benefits for increased bone density, breast and brain protection, as well as protection from age-related illness. These studies are made available by request. One size doesn't fit all. Individual dosing means that you get the proper dosing for your body based on very detailed blood test results. No guessing or long-term adjusting needed. So how do patients say they feel living with optimized hormones? Beyond saying they feel like themselves again, they say they have increased energy, mental clarity, improved muscle tone, and reduced joint pain. They feel happier, experience better sleep throughout the night, and increased libido and desire for intimacy. Many patients have told us that as a couple, being optimized has actually saved their marriage. So what are the next steps? The first step is having your blood tested to discover critical information on your hormone levels. Your next visit will indicate your individualized dosing of estrogen and/or testosterone in women and testosterone in men, depending on replacement needs. Then your tiny rice-sized pellets will be placed under the skin with no stitches required. You simply leave them in until the next treatment in 3 to 6 months, depending on your daily activity. Before we wrap up, let's glance at a few medical studies showing the positive effects of hormone therapy. A study was conducted to show the effects of testosterone use and how that relates to our bone health, and it concluded that pellets had a 4-fold increase on bone density over oral estrogen and was 2.5 times greater than that of patches. The results showed an 8.3 per year increase in bone density in patients using pellet therapy versus a 3.5% per year bone density increase using patches and a 1 to 2% per year using oral estrogen. Statistics have shown that women get Alzheimer's disease at an 8-to-1 ratio in relation to men. The bright side to this is that research shows women using testosterone are 50% less likely to develop Alzheimer's disease. While men are less at risk than women, men who have low testosterone are 3 times more likely to develop the disease. A study in the International Journal of Cancer in 2004 showed high levels of testosterone are not associated with increased prostate cancer risk. What they did report is high levels of estrogen in men can increase prostate cancer risk, showing that estrogen is the culprit in prostate hyperplasia and cancer. We know that as men age and their testosterone declines, this results in the estrogen that is in their body becoming more dominant. A good example of this can be seen in teenage males that have very high testosterone levels in their body, and they're reported to have little or no prostate disease or cancer issues. Now, let's take a look at the study conducted by the American College of Cardiology's 65th Annual Scientific Session, done in 2016. In this study, they examined the relationship between the number one cause of death, heart disease, and its relation to testosterone. The study was conducted on 755 male patients ranging from the ages of 58 to 78 years old. All of these patients were suffering from severe coronary artery disease. They grouped these male patients into 3 groups, all given various doses of testosterone. What this study found was that there was no convincing evidence of increased cardiovascular risks with testosterone therapy, while on the contrary, there appears to be a strong beneficial relationship between normal testosterone and cardiovascular health. Multiple studies have been conducted on the causes of breast cancer in women. The overall conclusion is that the culprit of these increased cases of breast cancer are a result of therapies using synthetic hormones, while the use of bioidentical hormones does not increase the risks. When synthetic hormones that do not match what is naturally created in the body attach to your hormone receptors, it blocks the opportunity for your natural hormones to attach. This causes less apoptosis, which is a form of programmed cell death that occurs in multicellular organisms. This creates less programmed cancer cell death, and the result of this? Tumors can grow more rapidly. We hope this information presented has shown that HTCA pellet therapy is a safe hormone replacement therapy that has been proven to be clinically effective and is a convenient treatment with low side effects. So take the first step to better wellness by talking to your HTCA provider today to see if bioidentical hormone replacement therapy with HTCA method is right for you. If you think you may be having symptoms of low hormones, we're excited to help you join the millions of others get on the path to feeling better with balanced hormones. You can ask your doctor or visit HTCA's provider directory at www.ht-ca.com to find a certified provider in your area and schedule a consultation. Thank you for watching, and we hope you found this information beneficial to you.